Welcome back, everyone. Good afternoon, and thank you for joining us for our update this week. Today, I'm joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here for the region of Peel, Tim Beckett, our Fire Chief and Director of Emergency Management, Caroline Riseborough, President and CEO of Trillium Healthcare Foundation, and Abdul Qayyum Mufti, or AQ as I fondly call him, who is on the Trillium Partners Health Foundation Board of Directors. First, please let me begin by congratulating Chrystia Freeland on becoming Canada's first ever female finance minister. I've had the privilege of working with Minister Freeland in her various portfolios over the last 6 years, and I know she is ready, and I know she works very, very hard. Yesterday was a historic day and a positive step forward for our country. We face tough times ahead as we shift to recovery, and I can't think of anyone better to handle our country's finances in the wake of the global pandemic. So congratulations, Minister Freeland. Just a few short hours ago, I was with Premier Ford, actually it was just an hour ago, as well as Minister Mulrooney, announcing the next steps to extend the Eglinton Crosstown to the Renforth Transitway Station. This has been a key transit priority for the City of Mississauga. We've advocated for this, and I'm so pleased to see that it is moving forward. Renforth Station is the final stop heading eastbound along the Mississauga Transitway, our rapid bus corridor along Highway 403. I cannot underestimate the importance of this project for Mississauga. It will be the key east-west regional transit link connecting my way to the TTC and beyond. Once completed, it will allow for more frequent and more rapid service to the airport corporate centre, the second largest hub of employment in Canada. It will make Mississauga more accessible to people across the GTA and allow for more seamless connections across our city and beyond. I want to thank the province for recognizing the importance of this project by getting shovels in the ground to advance the tunneling work needed to make this a reality. Since our last update, Mississauga has continued to make substantial progress in the fight against COVID-19. We've been holding steady in low single digits, enjoying several days with either zero or only one new daily case. As a whole, we continue to make progress as a region, but there's still more work that needs to be done to drive our numbers down. We've been in stage 3 now for 2.5 weeks, and we have seen businesses and workplaces starting to slowly reopen. It's nice to see people back at work and nice to see people out enjoying their summer as well. You've been careful, thoughtful and responsible, and thanks to your efforts, we haven't seen a resurgence. I can't thank our residents and our businesses enough. We need to keep up the good work. We need more. We know more people will be returning to their workplaces after Labor Day, after the long weekend. And kids will be going back to school. And while the border to the U.S. will remain closed for non-essential travel, our airways to many other countries have reopened. With more people moving out of their bubbles, we run the risk of a second wave. But rest assured, we are ready and we are prepared to respond. So it's important that we limit our movements where possible and continue to make COVID-19 prevention a part of our daily lives. As Dr. Tam said, we are working for a slow burn in the fall, not an uncontrollable fire. Here in Mississauga, we continue to take a cautious and thoughtful approach to reopening. We have opened our Central and Burnham-Thorpe libraries for computer access by appointment only, and have more free Wi-Fi hotspots available for weekly loans. We know that access to technology, from frontline education and resources to job search assistance, is one of the ways we can connect residents with opportunity and give them the tools they need to thrive in a post-pandemic world. On Tuesday, September 8th, we will begin reopening our community centres with modified fitness and recreation programming to ensure proper physical distancing. As with all indoor public spaces, face masks will be required when not engaging in physical activity. Registration for fall programming will begin on August 24th. And on September 1st, we will open reservations for spots in our drop-in fitness, aquatics, and therapeutic programming. This can all be done on our activemississauga.ca website. In the meantime, we continue to offer a range of new outdoor programming, including fitness classes, unplugged open mic nights, and a free digital summer concert series that showcase the best local Mississauga talent has to offer. This week, we're also launching Quiet Streets in 8 neighbourhoods across our city, with more to be rolled out in the weeks and the months to come. As we work to limit the spread of COVID-19, Quiet Streets will help facilitate physical distancing and promote accessible, safe, and shared use of neighbourhood roads by encouraging roads to be shared with pedestrians, cyclists, and motorists by permit, quiet, local traffic only. In the light of our new reality, we are doing what we can to foster a strong sense of community and to keep our residents connected and engaged. What better way to do this than our shared love of sport? Mississauga is quickly becoming a hotbed for basketball, home to the Raptors 905, road to the 6. Last year, Celebration Square transformed into Jurassic Park West, welcoming hundreds of thousands of people over the course of the championship playoffs. And today, we are thrilled to be announcing that we will be opening a new physically distanced drive-in Raptors viewing party at the Paramount Fine Food Centre, where fans can get together to cheer on our Raptors from the safety of their own cars. The first game on the big screen will be Game 3 versus the Brooklyn Nets. That's this Friday, August 21st at 1:30 p.m. This is a free event, but tickets must be reserved online in advance at ParamountFineFoodCenter.com. Tickets are available on a first-come, first-served basis. If you are able to give back, we are asking attendees to help support the Raptors 905 Breakfast with Santa campaign by donating a new or unused backpack to the cause. So don't forget to wear your jersey, bring a mask and lots of snacks, and get ready to cheer on our boys onto a second championship victory. I watched Game 1 against the Nets, and our Raptors look ready to take home the championship. Fingers crossed. Before I turn it over to Dr. Lowe, I want to take the opportunity to thank Premier Ford and all the ministers I had the opportunity to meet with over the course of the AMO conference this week. This has been an unprecedented year as municipalities are facing the economic hardships of COVID-19. Cities are the front lines, driving the economy and delivering critical services to our residents. A strong economic recovery will require healthy cities. Now more than ever, it's important that all levels of government work together, and conferences like AMO are a great opportunity for us to strengthen those relationships and chart a path forward. On that note, I want to thank Premier Ford and our Prime Minister for the $46 million that Mississauga was allocated through Phase 1 of the Safe Restart Agreement. This funding will help us kickstart our economy and ensure that we can continue to deliver the essential services and programs that our residents and that our businesses rely on. COVID-19 will bring additional financial pressures in the future, and we look forward to continuing to work with the province to determine how large urban cities like Mississauga can be best supported in the months and in the years to come. And to that end, over the last 2 days, we've had the opportunity to engage with provincial government ministers at the annual AMO conference. The Mississauga delegation held 11 meetings with government ministers, opposition leaders, and industry representatives. We had productive meetings, and we have advanced a number of our strategic priorities, from climate change to transit, infrastructure, and safe communities. And with that, I'd now like to turn it over to our Chief Medical Officer of Health, Dr. Lawrence Loh, to provide us with a brief update. Dr. Loh?
Thank you, Madam Mayor, and good afternoon. As of noon today, Peel Public Health has investigated 3,028 cases of COVID-19 in the city of Mississauga. 48 of these cases are active, 2,753 have resolved, and 227 residents have sadly passed away. In adding to the Mayor's thanks for the great work that Mississauga has done to combat this virus, I want to begin my remarks by stating the obvious. This is hard. As we move to stage 3, I made this very clear, that this is the hardest part of the pandemic. It's hard because now we're in control. What we do now determines what happens with COVID-19 in our community. And that is an opportunity we should not take lightly. Limiting proximity, duration, and numbers remains the key to interacting and moving forward through this, whether we're meeting a business partner, hosting a barbecue, or visiting our elderly loved ones. The Core 4 is a guide to helping us do so: distancing, masking, hand washing, and getting tested and staying home if we're sick. But we must do this in all of our interactions, steadfastly and consistently. Businesses and venues must also do their part to facilitate these behaviors as much as possible. And everyone is fearful of a second wave. But here's a little secret. A second wave will only happen if we let it. We can test, trace, isolate, and treat as much as we want with our hospital and healthcare partners. But preventing a second wave will take each and every one of us stopping transmission in the first instance. And that's hard, I know. But I know because we've done this before. We came together in March to bring this under control. We came together in May to slowly unlock our community. And we are still together now to make a difference. Now, I know we're all mourning in some parts a year that held so much promise. And being completely honest, this is as hard for me as it is for all of you. We need to remember that this has impacted every single person we interact with, whether it's our neighbor, a frontline worker, or a healthcare professional. Everyone has been challenged by COVID-19. And so compassion and empathy remain some of our very best tools. And listen, I too long for a freewheeling Friday night and some good karaoke with old friends. I am also tired of greeting my friends from 6 feet away or pretending that I'm waiting to use an ATM in every line that I stand in. I don't think any of us really realized just how much meaning in our lives happened within that 2-meter space that we have. But my professional opinion remains. We're all in this together, all of us, and we need to take this seriously, look out for each other, especially our most vulnerable, and we must continue to be kind. That's the only way we're going to get through this together. So let's limit proximity, duration, and numbers, and stick to the Core 4. And I encourage everyone to also download the COVID Alert app as another source of protection in detecting exposures. But let's all do our part to make sure that we hold off a second wave. Be sensible, be diligent, and above all, let's be kind. Thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Loh. As you may have heard me say before, this fight wouldn't be possible without the thousands of frontline healthcare workers busy at Trillium Healthcare Partners hospitals. Above and beyond the work that they are doing to fight COVID-19, Trillium Health Partners sees over 1.75 million patients a year, making it one of the busiest and largest hospital networks in the province. And as our city continues to grow and our population ages, it's imperative that we have a new and modern Mississauga hospital site to care for our residents. And in order to make that happen, we will need the entire community to come together with an all-hands-on-deck approach. And as we are here today to recognize a historic donation being made to the Rebuild Project on behalf of the Mississauga's Muslim community, we are pleased to have Carolyn Riseborough from Trillium Healthcare Partners Foundation and Abdul Akim Mufti joining us, AQ Mufti, I should keep it to that, joining us for this special presentation. Before I invite Caroline to say a few words, I want to thank AQ for his tireless advocacy for THP and his work throughout our community. He's a very devoted volunteer in the community. He has been a pivotal part of my annual citywide food drive and is also a member of our city's Diversity and Inclusion Advisory Committee. It's thanks to residents like AQ that our city shines. And on that note, I would like to invite Caroline Riseborough, President and CEO of Trillium Healthcare Partners Foundation, to say a few words about what this donation will mean for the future of healthcare in our great city. Caroline.
Thank you so much, Mayor Crombie, and it is a pleasure to join you here at City Hall today. We are here to make an historic announcement alongside our friends in the Muslim community. We are incredibly grateful and honored to announce a gift of $5 million to support the redevelopment of the Mississauga Hospital, and this is the largest gift to a hospital from the Muslim community in Canadian history. Trillium Health Partners is Canada's largest hospital, and last year was our busiest yet, with over 1.75 million patient visits. We are routinely at capacity, and COVID-19 has highlighted the challenges of our older buildings, especially our Mississauga Hospital. This generous, record-breaking gift will ensure that THP will be able to provide modern, leading-edge care for generations to come at the redeveloped Mississauga Hospital. But we could not do it without partners like our friends who are here with us today, who profoundly reflect the best of our city, province, and country's values by partnering to build a healthier community. Today's announcement is so important because I know that with your courage and leadership, you will inspire other communities, individuals, and organizations to join our cause and help build a healthier, stronger community. And with that, it is my pleasure to introduce my friend, Abdul Qayyum Mufti, THP Foundation board member and community leader.
Thank you, Caroline, and to Mayor Crombie for inviting us here today. Charity is at the heart of Islamic faith. One of the sayings of the Prophet Muhammad, peace be upon him, that says, "You're not a believer if you sleep with your stomach filled while your neighbor goes hungry." We are thrilled that the Muslim community will be recognized by the hospital for this gift, inspired by the teachings of Prophet Muhammad, peace be upon him. How we look after those in need of healthcare is a measure of our commitment to each other and to the health of our shared community across all backgrounds and across every faith. One of the noblest acts of charity is Sadaqah Jariyah, a perpetual act of charity with benefits that endure over time. The Muslim community is proud to support exceptional healthcare at Trillium Health Partners. Today, my associates, Nadeem Chaudhry and Ata Qureshi, and I are very proud to share that the Muslim community is pledging a gift of $5 million to support the redevelopment of Mississauga Hospital, and today we already have secured the first $100,000 for the donation. We are making history today with what is the largest gift from the Muslim community to any hospital project in Canada. The redevelopment of Mississauga Hospital will play a key role in the future health of this city and region, and hospitals rely on community support for the resources to provide excellent care and drive the innovation. Our contribution shows the importance of investing in the long-term health of the community. We encourage Muslim communities across Mississauga, Peel region, West Toronto, across Canada, and even beyond to join us in our support for Trillium Health Partners. In fact, we encourage all communities and of every faith to support this most important project. Thank you.
Thank you, AQ. And now I want to thank everyone for joining us again, and I'm prepared to take any questions from the media.
Mayor Crombie, your first question comes from Ashley Newport from Mississauga. Ashley, please go ahead.
Hi, Mayor Crombie.
Welcome, Ashley.
So I have my first question is about the transit announcement that happened earlier today when the province announced that it has plans to extend the Eglinton Crosstown to the Renforth Station and then eventually to Pearson Airport. I'm actually wondering, I assume that these are projects that would be covered by and paid for by the provincial and federal governments, but I'm wondering actually if the city or even the region of Peel would be expected to shoulder some of the costs associated with the projects once they built and then completed?
That's a very good question, Ashley, and that has come up in the past, but this is not one of the projects that the city is contributing to. This is a provincial project, and as you heard, that the Premier was inviting the federal government to share in the expense with him today. I guess he made a point of saying that both today and yesterday. It actually only touches Mississauga right at that Renforth station, and then makes its way back into Toronto up, well, goes into the airport, of course, after that.
Okay, thank you. And my follow-up question is actually about the Safe Restart Agreement. I know that last week, I believe it was last week, Mississauga learned that you'd be getting $46 million, which goes a pretty long way to covering the deficit, which I think sits at about $60 million. But do you expect to receive more from the federal and provincial governments to cover that shortfall, or do you think the city is going to have to make some tough decisions in the future, potentially with taxes to kind of make up for the shortfall associated with the COVID-19 lockdown?
It's an excellent question. So I understand that the $46 million is part of our phase one funding. So as you recall, we actually have a $107 million deficit, but we have been able to mitigate $47 million of it such that we're sitting at $60 million deficit. So of the $46 million that the provincial and federal governments are giving us through the Restart program, $31 million will go towards our transit losses, which are, of course, are non-recoverable as we were operating free transit, and the other $15 million will go to our other operating losses. So, you know, we're very hopeful this will go a long way. We will be making some tough choices at council. I'm very hopeful that we won't, the tax rate will not be impacted, that we could make some changes or adjustments in programs and services, etc. for this year. However, you may be aware also that the impact of COVID will last longer than 1 year. Certainly there will be an impact next year as well. We're predicting an ongoing deficit next year and in 2022 for at least 2 years as transit will be slow to recover and people will continue to work, and some will be a little more apprehensive, shall we say, about riding public transit. So transit may not come back. Even at our rec centres, people may not come back to 100% usage. And then there are different formulas that will impact us, such as the airport PILT formula, that will impact us for many years to come. And we had an opportunity to discuss that with the provincial government yesterday. So the effects of COVID will linger for Mississauga for certainly the next 2 years, but perhaps much longer than that as well.
Mayor Crombie, your next question comes from Khaled from My Second Home TV and Can India News. Khaled, please go ahead.
Mayor Crombie, can I build on the previous question?
Certainly.
Are we gonna see tax hike or no?
Well, Khaled, it's very difficult for me to say I'm one vote on council. However, my council has delivered a commitment to our residents that we keep our tax increases reasonable and in and around the rate of inflation. And I know we're going to do our utmost to maintain that this year as well. We will be looking at all programs and services to see where adjustments can be made to reduce and minimize the impact of COVID-19 on the taxpayer.
Thank you so much. And I just want to clarify, today's donation, the $5 million towards Mississauga Hospital, is the initial payment is $100,000? And if yes, the other pledge would be fulfilled when and how?
I'm going to let them respond to you, but I think the $100,000 was the first contribution to the $5 million pledge. But AQ or Caroline, would you like to come back and respond? I'm going to ask Mr. AQ Mufti to describe how the payment schedule for the $5 million. Thank you, Khaled.
Thank you.
Thank you for your question. It's an important question to explain. Yeah, the first $100,000 is going to go towards the total pledge of $5 million. This is again, before the announcement, we already have that $100,000 in hand. So that's a very blessing, I would say. But the $5 million will be the total pledge. That is going to be over 10 years, but we don't have to wait for that 10 years, and we are planning even to accomplish that much earlier than that. Is that?
Thank you.
Thank you.
Khaled, I'm back if you have a follow-up.
Thank you so much. That would be it. And thank you for everything you are doing right now. You are doing great, Mayor Crombie. Thank you so much.
I appreciate that. Thank you very much. But today is a very exciting day for us, not only the transit announcement, but the big announcement on behalf of the Muslim community in support of our Trillium Healthcare Partners rebuilding of our hospital. So it's a great day. Thank you very much for joining us today. Are there any further questions, Nicole?
Yep, your last question, Mayor Crombie, comes from Steve Cornwell from the Mississauga News. Steve, please go ahead.
Hi, Mayor Crombie, how are you?
I'm very well, Steve. How about you?
Good, thank you. A question kind of riffing off of Ashley's question about the Phase 1 and Phase 2 funding. The province is offering Phase 2 funding in addition to the $46 million that Mississauga is being allocated this year. Based on the financial situation, with the city, are you interested? Would you advocate for more funding as part of the Safe Restart Agreement from the province in Fed?
Yeah, yes, absolutely is the answer to that. Certainly, we know the effects of COVID-19 will last, but we will bear a financial burden for many years to come, but particularly the next 2 years, although it could extend beyond. We did our best to advocate changing the formula that will impact us greatly on the PILT formula, which the 5% cap on that, which impacts us greatly, but certainly for the next 2 years, and it could be lingering longer than that. So we will likely be make an application for the Phase 2 funding, as will many municipalities right across the 404 municipalities across Ontario.
Thank you. And the Phase 2 funding does have some conditions with it, including kind of closer collaboration, let's say, with Metrolinx and potentially exploring micro transit options. So critics of those conditions have said that, it could potentially handcuff public transit, such as My Way and other municipal transit providers. What are your thoughts on that, and is that a concern for you?
Not particularly relevant for Mississauga. That's in some of the smaller municipalities. I think they don't actually offer full public transit to their residents, and there are many of those that offer alternative versions of transit and different Uber taxi services, etc. So we would take the funding based on our ridership and our population for our My Way transit system, if it were offered. And we're just waiting to hear when the applications, the date for your applications will open.
That was your last question, Mayor Crombie, and this concludes today's press conference. On behalf of the Mayor, I want to thank everyone for participating. Have a great day, stay well, and enjoy the rest of your summer.
Thank you very much for joining us today. Thank you.